Okay, so we're going to be talking about plyometrics and just kind of going through the physiology associated with plyometrics and then eventually getting into some programming details. So it's kind of important for you to know and understand the kind of the physiology, the neurological effects, and just the effects on the soft tissue that occurs with plyometrics. So you know in programming how to do it and to understand what your goals are in incorporating plyometrics into your programming. All right, so looking at plyometric mechanics and physiology. So we're going to be looking at the mechanical model of plyometric exercise. So essentially looking at how our body structurally performs plyometric exercise and kind of what that means as far as the effects that we get from it. So when we do a plyometric activity, it's going to involve a rapid stretch of the musculotendinous component. Remember, our muscles, our musculotendinous unit in the body has elastic energy. So we're actually going to be using the elastic energy and then coupled with the neurological response that we get from that to be able to produce explosive and powerful movements. If the concentric muscle action follows immediately, the stored energy gets released and that increases total force production. So basically, if we have a rapid stretch or a rapid eccentric contraction of the muscle and then perform the concentric muscle action immediately afterwards, we actually get an increase in force production, okay? And again, this is known as the stretch-shortening cycle. So what we're basically trying to do is improve this aspect. This will help with improving rate of force development and will help improve our mechanical power. Okay, so remember, power is force times velocity or force times distance over time. And by performing this type of activity, the adaptation we get from the body is a much more efficient use of the stretch shortening cycle. Okay, so now looking at the mechanical model of muscle here as it relates to plyometrics, and there's going to be a little illustration on the next slide after this that kind of shows you in like a little bit of an abstract manner how all of these things come together. So the first component we have is what's known as the series elastic component, and what that primarily consists of is the tendon. This is kind of the big component related to plyometrics. So remember that our muscles have elastic qualities to them. So this is part of the elastic portion of the muscle that when we create that forced fast stretch, that fast eccentric contraction, this part is what stores that energy and then increases the subsequent force. So the series elastic component is really important in the performance of any type of explosive power-based activity, and you improve the function of it through plyometrics. Obviously, too, you have the contractile component. If you remember from 240 and your exercise physiology class, so the sliding filament theory, so this is all those sarcomeres that are present in the muscles. Remember, the sarcomere is the smallest contractile component of the muscle. Your actin and myosin as they slide over each other. So this is the primary source of muscle force during the concentric muscle action. So when you have that fast eccentric stretch, there's energy that gets stored in the series elastic component. Then as your contractile component with your fast concentric contraction further contributes to force, okay, during the performance of those explosive plyometric type activities. Then you have the parallel elastic component. Now the parallel elastic component really doesn't play a role in plyometrics per se, but it is a part of the mechanical model of skeletal muscle. So the parallel elastic component, if you remember talking about the epimysium, perimysium, so all of those fascial structures that kind of cover the muscle, these basically all exert a passive force with unstimulated muscle stretch. So like, for instance, when you passively stretch a muscle, this part of the muscle provides a passive force to that kind of passive stretch. So it's not as involved. It's really the interplay between the series elastic component, which is really kind of one of the main power generators of a plyometric, and the contractile component. So in looking at this, you could kind of see if this is that mechanical model. So this is representative of a muscle, okay? So here's your parallel elastic component. Remember, there's not really a whole lot of involvement with the plyometric with the parallel elastic component. Again, that's the epimysium, perimysium, endomysium, all those kind of passive structures, which again can provide resistance to muscle stretch, but it's really with a passive stretch. Down here, and the reason why it's called the series elastic component is because these are all of the components that are in series with the contractile component. If you look at the contractile component over here, if you remember from, again, those other classes I talked about, you have your actin and myosin. So the actin's a little thin filament, the myosin's the thick filament. You get those cross bridge formations, and the actin filaments will slide over the myosin. Here's the series elastic component. So that forced fast eccentric contraction, you get energy storage in the series elastic component. Then with a fast concentric contraction immediately afterwards, you get your force production. So this is where your mechanical force production is really occurring when we're performing plyometrics. Okay, so plyometric mechanics and physiology. So the neurophysiological model of plyometric exercise. So again, nervous system activity is very important here with the plyometrics. So this model involves potentiation, so a change in the force velocity characteristics of the muscle contractile component caused by a stretch. And then you get so you're basically getting the addition of the stretch reflex, enhancing the concentric muscle action. So the stretch reflex is the body's involuntary response to an external stimulus that stretches the muscle. So you commonly would also see this, in performing a neuro-eval, when the neurological evaluation component, when you actually do, when you test someone's reflexes. So when you take the little reflex hammer and you tap the tendons, what you're actually doing is you're inducing, when you tap the tendon, you deform it, and you induce the stretch reflex. That's why you see that little contraction happen if the nerve root that you're testing is intact. You're working basically a similar thing here. You're basically using a fast eccentric stretch of the muscle to further enhance your concentric contraction. So and I've shown this illustration before. So if you look at this, this is an illustration of the stretch reflex. So when the muscle spindles are stimulated, the stretch reflex is stimulated. So right in here, okay, so you have your extrafusal muscle fiber, that's the contractile, and you have your intrafusal fiber, which is your muscle spindle, okay? So you can see the muscle spindle in there. So when this muscle stretches, and particularly stretches rapidly and fast, it sends an impulse to the spinal cord, okay, via type 1A nerve fibers, okay? It goes into the dorsal horn of the spinal cord, comes out of the ventral root. So sensory information goes in the dorsal root of the spinal cord, motor information comes out of the ventral root. And then as the motor information rapidly comes out, the alpha motor neuron synapses with the nerve root at the muscle, and that produces a fast reflexive muscle action. Okay, so what you're seeing here is that volume of information, and it happens very fast. So this is information that goes directly into the dorsal horn of the spinal cord and then proceeds to come out of the ventral horn, which then produces that fast muscle contraction. So kind of continuing on with looking at the physiology associated with this. So again, the stretch shortening cycle, which is what we're looking at, and we kind of led into this before, this employs energy storage to the series elastic component and stimulation of the stretch reflex to facilitate maximal increase in muscle recruitment over a minimal amount of time. So what we're looking to do is get as much muscle recruitment and have that not only have a strong contraction, but also have a fast contraction. So again, when we're trying to improve properties related to the rate of force development with a lot of our athletic activities, that's what we're doing here. Okay, we're using the stretch reflex to help with this stretch shortening cycle, which utilizes those other components of the muscle. So we know when a muscle contracts, we use our contractile component. This enhances the elastic portion of our muscle that we could store energy in to further help with not only just strong contractions, but fast contractions as well. So in looking at this, so the stretch shortening cycle, so again, we look at a fast rate of musculotendinous stretch is vital to muscle recruitment and activity occurring from the stretch shortening cycle. So not only do we want to have a stretch occur, but the idea is to have it occur fast. Again, think about if you were to do a max, you were testing your vertical jump. What would you do? Would you lower yourself slowly and try to jump, or would you lower yourself down really fast and try to come right off the ground? You do the second, okay? And that's what you're basically doing here. So not only do you want a stretch of that, but you want a fast stretch. So that's an important component to that is very important as well. So we get that stored energy in the series elastic component. That's going to stimulate your muscle spindles. And then the idea is you're going to get that type 1A afferent nerves to synapse with the motor neurons, and then that's going to transmit signals to that agonist muscle group in order to do that. And again, so we have 3 phases associated with a plyometric. You have the eccentric contraction, which again is preferably happening very fast. So you get that fast eccentric contraction. You have the amortization phase, which is the phase in between the muscle contraction, okay? So you have fast eccentric, the amortization phase is in between, and then your fast concentric contraction. So the idea is we have these 3 phases of what's going on with the muscle contraction that's going to enhance that rate of force development, and not only getting then a strong contraction, but also a very fast one. Because again, our goal is with our athletes is to help improve the rate of force development, to help improve their mechanical power. Okay, so further looking at the stretch shortening cycle. So on the next slide, there'll be a little picture kind of showing you how this is actually going to take place. So it's going to show you the long jump in the stretch shortening cycle. So the eccentric phase is going to begin at touchdown, and it's going to continue until the movement ends. The amortization phase is going to be the transition from the eccentric to the concentric. The idea is this is going to be quick, and there's not going to be any movement during this phase. So it's basically the amortization phase is basically the transition between the eccentric and concentric. And then the concentric phase is going to follow and is going to compose the entire push-off time until the athlete's foot leaves the surface, okay? And this would be the same for any type of jump activity if being done for the purposes of improving rate of force development, mechanical power. So here's exactly what we're looking at from the long jump. So you could kind of see, so the foot coming down and striking is going to put that fast eccentric contraction. You have the amortization phase. That's going to be the time in between. And then you have that fast concentric contraction, which is basically occurring up until the point that the foot actually physically leaves the ground. So in looking at kind of how we utilize all of these different exercises, and your book uses a classification system that's pretty widely used regarding plyometrics, and we'll get into that. I don't know if we'll get into that in this talk or when we have the second part, but we'll get into the classification of exercises. Certainly make sure to look at those prior to coming into class as well. First thing you have to do is a needs analysis. So again, athletes, just like with everything else, they need to be evaluated for their sport position, and training status. So all of these things need to come into play, because what this is going to tell you is kind of what types of exercises maybe you need to start with, and what you need to be thinking about planning in the future. So there's multiple things at play here. So you may look at an exercise and say, well, that's really good for this sport or even for this position, but maybe because of their training status, they're not really prepared to do the particular exercise you're doing. So for instance, one example of a really good plyometric exercise is what's called a depth jump. It's a really good plyometric exercise, but it's very stressful. Most people starting out, I'd probably say just about anybody just starting out is not prepared to do them yet. So even though it's a great exercise, not everybody's going to be ready to perform them yet. So by understanding each sport's requirements and position, the needs, you can kind of incorporate safely your plyometric training program. So again, there's going to be some work that they need to do to make sure that they're physically prepared to do more advanced plyometrics. And again, light plyometrics can be started by most people early on. They just, again, might be done for different purposes, more to prepare them for some of the more advanced exercises that they would do. So we look at the mode, lower body plyometrics. So again, just about any athlete in any sport needs to do at some point some type of lower body plyometric or jumping activity. So you see a pretty good volume of these getting done. Again, the direction of the movement varies by sport, but most sports require athletes to produce maximum vertical or lateral movement in a short amount of time. So there's not too many sports where vertical force production, even if they don't do a whole lot of jumping per se in their sport, there's still vertical force production that's going to be occurring with running, as we'll talk about when we get into the chapter on speed. And we obviously know that lateral movement, the quickness that we need with lateral movement. So there's really application to a lot of these lower body plyometrics with just about any athlete. And again, there's a wide variety of lower body drills, various intensity levels and directional movements. So you could kind of look at, and we'll have further discussion on this, but you could kind of, again, look at and examine where the athlete is at to determine kind of what types of exercises. And again, if you're ever in doubt, you're always better off going with some lower intensity movements just to kind of get the athlete started out. So here we'll kind of look at our different classifications of plyometrics. So we are going to get into this a little bit. I wasn't sure if I would get into it here or not. Jumps in place. So basically, these are all classifications of drills. And even within these drills, there's various intensity levels. So jumps in place are drills that involve jumping and landing in the same spot. So this is emphasizing the vertical component of jumping, and these are going to be performed repeatedly without rest in between jumps, okay? So the time in between jumps is basically going to be your stretch-shortening cycle's amortization phase, okay? So things like this would be like squat jumps and tuck jumps would be some examples of this. Standing jumps could emphasize either horizontal or vertical components. So standing jumps are basically maximal efforts with recovery between repetitions. So basically, this is just doing one good jump and then recovering between your repetitions. So unlike jumps in place, which are happening one after the other, and the feet are landing in the same spot, standing jumps can be either vertical or horizontal, and they're basically like maximal attempts. Multiple jumps and hops involve repeated movements again, but these are kind of a combination of jumps in place and standing jumps. So unlike the jumps in place, multiple jumps and hops can also be done horizontally, and you could also include some diagonal directions as well. Bounding. So bounding drills are basically exaggerated movements with greater horizontal speed. So typically bounding is something that really does complement your actual speed and sprinting work. And if you look at a lot of the bounding exercises and make sure in your textbook, you kind of look at and go through some of the exercises so you could kind of give examples of those. But bounding drills, if you look at them, so they're described as more exaggerated horizontal movements, but if you almost look at them, a lot of them look like almost exaggerated running cycles or sprinting cycles. So they're commonly used for this, and they're usually done, they cover distance. So usually when you're doing your volume for these, we'll talk about how you track foot contacts. With these, you look more at the distance that you're doing them for typically. Box drills are drills that, again, they can increase the intensity of some of your jumps by using a box. So So the height of the box you're going to use, and typically these involve jumping up to a box or just landing from a box, not jumping yet, because that takes off of a landing, because that takes you into the next category. But these will utilize, and you can also do single and double leg variations of this, just as you can with, I forgot to mention that with some of the other drills as well. And then the most intense category of plyometrics are your depth jumps. So depth jumps are very effective, but they're also very demanding on the body. So when you're doing depth jumps, one, you have to make sure that the individual is prepared to do them. And again, sometimes it takes a little bit of buildup for that to occur with individuals doing depth jumps. But these are very good at improving that rate of force development and fast explosive power, but they need to be built up to, because they're very stressful neurologically, and they're also very stressful structurally on the athlete as well. So now looking at upper body plyometrics. So upper body plyometrics consist of various types of exercise. So medicine ball throws, catches, and several types of push-ups. It's very important that, again, you're getting that rapid muscle action with the upper body plyometrics. When you look at trunk plyometrics, exercises for the trunk can be performed plyometrically, but modifications need to be made. So you need to make sure that the exercise movements be shorter and allow for that stretch reflex. So very commonly, for instance, you'll see individuals go on like a decline bench and do a sit-up and throw a medicine ball to somebody. Then that same person will throw the medicine ball back. They'll catch it, go back into the sit-up, and come back up. That's not really a plyometric type of movement if you think about it, because when in looking at it, you're not really getting that fast stretch reflex as a function of what it is you're doing. So it's not really a plyometric exercise. For a trunk exercise to be plyometric, it's got to have that fast transition between the eccentric and concentric muscle contraction. So it's very important to make sure that that aspect is included as well. Now, it doesn't mean that it's a bad exercise. It just means that it's more of just like a weighted exercise with a throw. It's not classically a plyometric. So again, it's an exercise you can use, but you just have to understand why it is you're using it. So in looking at plyometric exercise, I had mentioned the importance of monitoring intensity. So you need to consider both structural and neurological stresses when you're designing a plyometric program. So, and the neurological stress is important. So again, we're going to be using, a lot of the times this is going to be these jumps, most of them will be considered high intensity elements. So you need to make sure you're getting appropriate rest in between your sessions. So plyometric intensity is going to also include, so again, these are your structural components. So muscles, connective tissues, joints. Basically all the tissue in the body is going to be stressed pretty hard by plyometrics. And again, you're going to control intensity primarily by the type of drill you're doing. Okay, so I'm encouraging you to go into the exercise index in the chapter and make sure to kind of go through those. Again, if we're talking category-wise, depth jumps are always the most intense category-wise. Second to that would be bounding. Bounding can be pretty stressful as well. Then with the others, it all just kind of depends on the exercise you're doing. But your depth jumps would be 1, bounding would be 2, and then the other categories after that, it would depend more on the type of actual jump you were doing. So generally, as intensity increases, your volume should decrease. So you're going to get some general guidelines as far as volumes, but you should kind of note that really in the end, the volume that you're going to do or the amount of exercise you're going to do is really going to be based regarding this on more so on the types of exercise you're doing. So for instance, if an athlete's doing depth jumps, they can't do the same volume of depth jumps that they would if they were doing, say, box jumps or, squat jumps. the volume would have to go down relatively compared to those other movements. So these are some other factors that do play a role with intensity. And again, I still encourage you to look at the different exercises, but these are things that could also impact the intensity of the drills. So the points of contact. So the ground reaction force during a single leg exercise places more stress on the obviously extremity and the muscles, connective tissue than double leg plyometrics. Okay, so if you're doing a single leg plyometric, there's going to be obviously much more structural stress because you have your body weight, kind of landing and coming off of one leg. The speed of the drill, so the faster that you're doing the drill, obviously the intensity increases. The height of the drill, so I had mentioned about depth jump. So when you do a depth jump, you're landing from a height. So now not only do you have the athlete's weight coming down, but you also have the added force of gravity, which is increasing the intensity of the drill. So the higher the body center of gravity, the greater the force on the landing. That's going to make it more intense. And then you have to consider the athlete's body weight. So the greater the athlete's body weight, the more stress is going to be placed on those tissues. If you're also using external weight, so for instance, you're doing loaded jumps with using a weight vest, a barbell, things like that, that is also going to further increase the intensity as well. So these are all things that you want to kind of look at as far as, in programming and exercise selection, what you're going to be doing intensity-wise for your athlete. So your frequency, typically the guidelines, you want 48 to 72 hours, and it says 42 up there. 48 to 72 hours would be good between plyometric training sessions. And again, using typical recovery times, you're looking at 2 to 3 plyometric sessions per week. So kind of when you're planning out your training week, all of your different training elements, usually around 2 to 3 per week is going to be plenty. I would say most of the time for me personally, in my athletes, I use probably 2 most of the time. But when you're considering recovery and all of your other training elements, 2 to 3 would typically work. Okay, and looking at recovery. So the big key with a lot of things involving plyometrics is making sure they get enough rest. Okay, this is not, most of the time when you're doing these exercises, you're not doing them for metabolic conditioning. You're doing it for power development. You're doing it to improve explosive strength. You're doing it to improve rate of force development. So there needs to be appropriate rest. So here's just an example for depth jumps. You want to go about 5 to 10 seconds rest between reps, 2 to 3 minutes between sets. And usually your reps per set for depth jumps are going to be pretty low. Again, your overall volume for them is going to be low because they're a very intense type of exercise. And in general, you look for a much longer work to rest ratio with a lot of these exercises. So about a 1 to 5 to 1 to 10 work to rest ratio. When you're doing these types of exercises, again, and you really have to communicate that to the athlete, because again, the common thing is well, I'm working out, I need to be breathing heavy and everything else. They're going to think that they're not going to realize they're not recovered the way they should be. So make sure you tell them, look, you're going to feel like you can do again, make sure you keep your rest periods as they are. So again, they should not be thought of as cardiorespiratory conditioning exercises, but as power training. This is what we've been talking about. And again, drills for a given body area should not be performed more than 2 days in succession because, again, the connective tissue, much like we talked about with resistance training, the connective tissue has to be able to recover. And then for volume, so for most of your lower body drills, we express volume in foot contact. So basically each time the foot contacts the ground, that's kind of how we track our volume, except with bounding where we count bounding in distance. So it's just easier for bounding drills to count it as distance because sometimes the foot contacts could vary a little bit more depending upon the height, how tall the athlete is. For upper body drills, just express the number of throws or catches per workout. And then it's recommended, I'm going to give you some recommended lower body volumes. They can vary depending upon levels of experience, but on the next slide, I'm just going to show some general guidelines. that you could at least remember to start. And then again, just know that it can still vary a little bit depending upon what else the athlete is doing. So these are your beginning volumes. Now the volume is the contacts per session. Now I want you to know these volumes, but I will tell you that even for me, most of my programming, I don't exceed the 80 to 100 typically for most people. So most of my programming has actually just even been within the beginner range. Not that everybody I work with I would classify as a beginner, but just because of the intensity of which they're doing things a lot of times, I find that doing a much lower volume is better. Now, again, that could change a little bit based upon the structure, what type of periodization you're using. So I would tell you, know these as far as beginner, intermediate, advanced, high, medium, low, for testing purposes, but for practical application purposes, you may end up seeing that a lot of your volumes actually generally stay closer to that beginning volume, particularly if you start to do more high intensity jumps.